Hello everyone, I am Dr. Sudheer Koganti, a consultant cardiologist working at Citizen Specialty Hospital, Hyderabad. I do complex coronary interventions, heart failure work, including assessment for transplantation, and also structural heart disease, including TAVI procedures. TAVI means Transcatheter Aortic Valve Replacement. Have you ever heard about replacing somebody's heart valve without opening the chest? That's TAVI. In TAVI, we replace a diseased aortic valve, a process which is called as aortic stenosis, with a newer valve. How do we know if somebody needs aortic valve diseased or that needs repairing? It depends upon their symptoms, i.e. history, ECG, and also 2D echocardiogram. Once we identify if somebody's got severe aortic stenosis and then needs replacement, we assess if they're suitable for TAVI or not by doing a CT scan. Once the CT scan shows that the access site and everything is suitable for a TAVI procedure, then we schedule them for TAVI procedure. TAVI procedure is pretty straightforward if provided the CT findings are all in line and are not favorable. In TAVI procedure, which takes no longer than 1 to 1.5 hours, it's scheduled in a cath lab, and patient is often not even anesthetized. They are consciously awake, and then we go from the groin area, just like a stent procedure. It's just the tubes are slightly bigger, and implant the newer valve, finish it, and come out. Patient usually is completely awake by the time we finish the procedure. They walk the next day, moved out of ICU the next day, spend a day or two in the room, and then go home within 3 days' time. And all they have to take is 1 or 2 blood thinners along with their usual medications. You may get confused. We use a lot of names when we say TAVI or TAVI. We say Edwards, Evolute, MyValve, Hydra, and so on. It doesn't matter. At the end of the day, if a particular patient needs TAVI and they're suitable for TAVI based on the CT scan, we recommend the right valve for you, and then you can choose which one you want to undergo. So, if you were experiencing any symptoms such as breathlessness or dizziness, get an evaluation with a cardiologist wherein they would do ECG and echocardiogram and find out if you got aortic stenosis or not. On the other hand, if anybody told you you've got aortic stenosis and you need a TAVI procedure, happy to go through the data and give you an opinion. Thank you.